Welcome back to the Popkin Method, where real medicine meets real results. If you've been sleeping poorly, feeling wired but tired, gaining weight, or struggling to focus, there is a reason. And today, Dr. Popkin is here and he's breaking down what he calls the symptom spiral: how sleep and stress quietly disrupt your hormones, brain, metabolism, and energy. And more importantly, how to finally stop the cycle. So I know I'm excited to hear about this because I find myself a little bit in this pattern. So I'm excited to get educated by you today. So welcome. Nice to see you.
Nice to see you as
Um,
well. This is going to be a rather detailed description about sleep medicine. So everyone should plan for some good information here and a rather informative podcast.
awesome. Let's get into it. I have some good questions for you today. So I know you see a lot of patients and you've seen so many patients within your career, but some who may find themselves feeling stuck or in the wired but tired zone. So what does that actually mean? And what does it mean physically, mentally, and emotionally?
Well, the wired but tired syndrome describes a state in which a person feels exhausted, yet they're overstimulated. They're unable to relax. They can't rest. They can't sleep despite feeling physically, mentally, and emotionally drained. It's a hallmark of central nervous system dysregulation and adrenal imbalance, often linked to chronic stress, poor sleep, disrupted circadian rhythms. So I'll give you a breakdown of what's happening and why. So the core concept about regarding wired but tired, it occurs when the body's stress response becomes overactivated and eventually becomes depleted over time. Early on, there's an early stressor that leads to excess cortisol and adrenaline release. That leads to being alert and having higher energy, maybe some anxiety and hyperarousal. This is the typical fight or flight response you've probably heard about. And this is helpful in the short term. It helps people adapt to stressful situations. However, over time, chronic stress makes your body unable to turn off the stress response, so you feel wired. And in later stages, what happens is it leads to adrenal gland fatigue or dysregulation, where cortisol production becomes erratic or low during the day when it's supposed to be high. And then therefore you feel tired. And then you end up feeling tired in the body, but wired in the mind. So that's really the tired but wired response that we're talking about here. So let me go over some of the mechanisms that are involved so you can understand what this is all about. So first of all, cortisol dysregulation. We're going to talk about this a lot. Normally, cortisol peaks in the morning to give us energy for the day, and it drops at night so we can rest. Cortisol is one of the major hormones produced by the adrenal glands to control energy levels in the body. In wired but tired, cortisol may spike in the evening or stay high all day, which prevents you from resting. Over time, the rhythm flattens, leading to low energy by day and restless at night. The other things that occur are sympathetic dominance. This is another mechanism of what we're talking about here. The sympathetic or fight or flight response, the nervous system stays switched on, and the parasympathetic rest and digest system can't engage, so relaxation feels impossible. Other mechanisms involve neurotransmitter imbalance, which is excess glutamate, adrenaline, norepinephrine, which leads to hyperarousal, anxiety, and insomnia. And then you get depletion of GABA and serotonin, which leads to poor sleep, low resilience, and irritability. Another mechanism, we get circadian rhythm disruption, which is generally caused by blue light exposure from computers and your cell phone, having erratic schedules, overuse of caffeine during the day because you're tired, and the stress hormones all altering melatonin secretion, which leads to circadian rhythm disruption. So what are the common symptoms of feeling wired but tired? People typically feel fatigue. They have low stamina throughout the day. They may have racing thoughts or anxiety at night. They may have light or unrefreshing sleep, or even insomnia where they can't go to sleep at all. They may feel heart palpitations, jitteriness, muscle tension, feeling tired, but you can't turn off your body, or you can't turn off your mind. You may have sugar cravings or caffeine cravings throughout the day, or even in the evening. You may have brain fog, poor focus, heightened stress sensitivity. So a lot of these things, I'm pretty sure most of the listeners can relate to. So a typical cycle, you get chronic stress, which leads to elevated cortisol and elevated adrenaline. leads to poor sleep, which makes you more fatigued, leads you to use more stimulants like caffeine and sugar. Then you eventually develop adrenal gland strain, which leads to irregular cortisol output, and then a persistent fatigue with restlessness, the wired but tired state. So this is basically what we're talking about, and we'll address all of these concerns during this podcast.
Absolutely no. I'm definitely intrigued because I know so many people probably have a lot of these symptoms. So I know I myself I feel like you're speaking to me directly with a lot of these things. So I'm sure there's a lot of good information you're gonna shed some light on. So then beyond that, what's the connection between sleep stress and symptoms like brain fog or cravings, low motivation, or emotional reactivity?
Well, the symptom spiral related to poor sleep, it refers to this self-reinforcing cycle where inadequate or disrupted sleep worsens your physical and mental symptoms, which in turn further interferes with sleep, creating a downward spiral or declining health and function. So here's how it typically unfolds. The sleep symptom spiral begins typically with an initial trigger. Poor sleep begins due to stress or pain, hormonal imbalance, anxiety, lifestyle disruption, like either getting a new job or having a newborn child. Even short-term sleep loss can lead to mood changes, hormone metabolism, and immune function changes. Everyone knows that if you have a poor night's sleep, you typically don't feel well the next day. So if that happens on one time, imagine pairing up multiple days or weeks of months of poor sleep. So that can tend to lead to some pretty damaging results in your body. Some of the physiologic and neurochemical disruption that we see, again, we're going to talk about this a lot. You get increased cortisol and adrenal activation, which heightens your stress reactivity. Decreased melatonin and growth hormone, which impairs your recovery and tissue repair at night. So when you're supposed to be sleeping, and having these chemicals help to repair your body overnight, this is not occurring. Reduced serotonin and dopamine affects your mood and your motivation. Some of the other symptoms that we can relate to would be fatigue, irritability, anxiety, brain fog, muscle pain, increased systemic inflammation. Can also lead to blood sugar dysregulation, increased appetite, which leads to metabolic strain. A lot of people, when they're tired, they reach for food for comfort, and therefore can gain weight from that. They can get reduced libido from low testosterone and estrogen balance. Thyroid dysregulation may appear, further making people feel more tired, gaining weight. There are some behavioral and emotional effects. Fatigue decreases motivation for exercise and healthy eating. Anxiety and pain increase rumination at night, worsening insomnia. You're laying there at night trying to fall asleep, trying to solve all the world's problems, and wondering why you didn't think about these things during the day, but now at night you're trying to sleep, you can't turn your brain off. Daytime sleepiness leads to more caffeine intake. Everyone can relate to this. You're tired during the day, you're at work, you realize you've had 3, 4, 5 cups of coffee, and all throughout the day, this caffeine load will build up and will prevent you from sleeping at night. And then some people compensate by using alcohol at night, which is a bad choice because alcohol does not give you a restorative sleep. And then, of course, late night screen time, all of which worsens sleep quality. I don't know how many of you go to bed with your cell phone at night, looking at the phone and wondering why you can't sleep when you have this device in your hand that's stimulating your brain, not allowing you to sleep. So typically what we see is just reinforcement of the cycle occurs. Each one of these symptoms leads to more fatigue, more inactivity, weight gain, hormonal disruption, worsening sleep. They all reinforce each other. And over time, chronic sleep becomes both a cause and a consequence of multi-system dysfunction, which I'll discuss later on in the podcast. It becomes a vicious cycle.
Absolutely, yeah, certainly sounds like it. And most people think of sleep as a result, not really a diagnosis. So you treat sleep as a core part of your method. So why do you feel like sleep is should be considered a diagnosis? Can you explain a little bit about that with your approach?
Sure. Well, I mean, as you can see from what I've mentioned already and what I'm going to mention, Sleep is pretty much the most fundamental thing that we need next to, breathing, food. Sleep is so important. So treating poor sleep is really critical to improving a patient's overall symptom profile because sleep is foundational to biological processes that directly affects nearly every system in our body. And when sleep is inadequate or fragmented or unrefreshing, it just amplifies dysfunction across all physical, cognitive, emotional, and metabolic domains. So I'll give you a detailed breakdown of why addressing sleep is so important. As I mentioned before, pretty much everything in your body is affected by sleep. And sleep regulates the stress response. So poor sleep keeps the body in a constant state of sympathetic fight or flight activation. It leads to elevated cortisol and adrenaline levels. And that's what is our body's normal response to stress during the day. But when when those levels stay high throughout the day, you begin to burn out the adrenal glands from overstimulation. And this heightens anxiety and irritability and restlessness. It can worsen conditions such as hypertension, chronic pain, mood disorders. Everybody knows that you don't feel well the next day when you don't sleep. And if you have underlying medical issues, poor sleep just makes it worse. Restorative sleep, however, particularly the slow wave sleep, restores the parasympathetic balance in your body, calming the nervous system and promoting recovery. Sleep also reduces inflammation. A lot of people don't know this. A lot of doctors don't know this, but or they know it, but they don't consider it in the patient's treatment plan. Insufficient or fragmented sleep can increase systemic inflammation. It upregulates inflammatory cytokines like interleukin 6, TNF alpha, C-reactive protein. All of these are markers that can be measured with blood tests. Chronic inflammation contributes to pain and fatigue, autoimmune symptoms, metabolic dysfunction. Deep, consistent sleep, however, helps to regulate the immune system and reduces inflammation, which improves pain and fatigue. Sleep also supports hormonal balance, and a lot of people don't realize this as well, but sleep deprivation disrupts your hormone regulation, including eventually decreasing growth hormone, testosterone in men, estrogen and progesterone in women. It increases cortisol, as we discussed. It can alter thyroid and insulin signaling. It can lead to disrupted estrogen and progesterone balance in women, which causes symptoms that are wide-ranging, can even mimic early menopause. Proper sleep, however, will restore endocrine rhythms, improving energy, libido, mood, weight regulation. I got a long list here, so we're going to go over all of these so we can, fully understand just how involved sleep actually is in your body. Sleep restores cognitive and emotional function. Poor sleep impairs memory, focus, decision making, and emotional regulation. Everybody knows if you don't sleep well, you don't think well the next day. You have that brain fog. Poor sleep increases your susceptibility to depression and anxiety and irritability. Quality sleep, however, will enhance mental clarity, and mental resilience, and emotional stability, making patients more capable of sustaining healthy behaviors and coping with stress. Everybody knows if you get a better night's sleep, you function better the next day. Sleep also enhances pain modulation. This is something that, again, is very, very important. Sleep deprivation reduces pain thresholds, so people feel more pain when they're not sleeping well. Sleep deprivation, it causes a vicious cycle. Pain disrupts sleep. Poor sleep amplifies pain. Improving sleep quality will enhance your endogenous pain inhibition. It helps reduce chronic pain symptoms. Sleep also optimizes metabolic and cardiovascular health. Poor sleep is definitely linked to insulin resistance and weight gain, linked to elevated blood pressure, cardiovascular risk, and something that we'll talk about a little bit more in this episode and more in future episodes. It reduces mitochondrial efficiency and energy metabolism. We'll talk about mitochondrial health. This is coming up a lot in social media and other outlets, and we'll discuss this more later. Proper sleep, however, it improves metabolic efficiency, cardiovascular recovery, and energy levels. And sleep also improves treatment responsiveness for every other treatment that we're trying to achieve in patients. Without adequate sleep, patients have reduced responsiveness to lifestyle, hormonal, and regenerative therapies. So pretty much everything we're trying to accomplish is sabotaged by poor sleep. Restorative sleep will allow cellular repair, peptide and hormone efficacy, immune modulation. It's so involved, and it's such an important topic that I'm really excited about doing this podcast.
Absolutely. And it is such important information for people to know. And for someone, even myself, who suffers from cortisol issues, I don't even realize how intricate and how all these things are correlated. So obviously, sleep is super crucial. And you touched on stress a little bit earlier, but can you walk us through what happens in the body when someone is actually chronically stressed, from cortisol to circadian disruption?
Sure. Well, first of all, to address your comment here prior, this is why lifestyle modification with sleep enhancement is really the first focus of what I do. With the Popkin Method, because without proper sleep, everything else just any other treatment modalities are much less effective. And when we're talking about the biology of burnout, which is what you're probably referring to here. When people are chronically stressed, their cortisol production and circadian rhythm gets thrown off. And the circadian rhythm is the body's internal 24-hour clock. And that becomes significantly disrupted. And, typically, the sun comes up, it gets light out, people wake up, they go throughout their day, the sun goes down. Their cortisol will decrease and will allow them to go into more of a rest and relaxation and sleep pattern. But when this gets disrupted, it's very difficult for the body to compensate for these changes. So a normal circadian rhythm with cortisol in healthy individuals, cortisol peaks in the early morning, around 6 to 8 in the morning, and this is how our bodies wake up. It increases alertness, mobilizes energy, raises our heart rate. And we wake up and we take on the day, and then it gradually declines throughout the day, reaching its lowest point at night, which allows us to rest and help with tissue repair and regenerative sleep. But this pattern, just so that we can understand this here, the pattern is very tightly regulated by something called the hypothalamic pituitary adrenal axis. We'll call this the HPA axis. And really what this is your hypothalamus communicating with your pituitary gland, which communicates with your adrenal gland to secrete this cortisol in the manner in which we talked about, high during the day and low at night, and to synchronize it with light exposure and wake sleep cycles. But when that's off, it causes significant disruption. So under chronic stress, it leads to persistent activation of this HPA axis. And over time, it causes several maladaptive changes in the body. And the first thing is that it causes a flattening of the cortisol curve. So instead of a sharp morning peak and a low evening trough, cortisol remains elevated or erratic throughout the day. You may see even low morning cortisol, which gives you trouble waking up, makes you feel fatigued during the day. And then, of course, you compensate by taking more caffeine and more sugar, which further perpetuates the problem. And then in the evening, you get high cortisol when it's supposed to be low. Therefore, you're wired, but you're tired and you have difficulty falling asleep. So this chronic stress also causes a loss of the circadian rhythm. So the normal rhythmic pattern, it becomes blunted or even inverted, where cortisol may not even respond appropriately to the daily cues, such as early morning light exposure or evening darkness. So now your body's circadian rhythm is starting to flip. So people are feeling tired during the day and they're feeling more energetic at night, and then they can't sleep, and it perpetuates the problem. So the body loses synchrony with the natural cycles of sleep, appetite, temperature, and mood regulation. And all of this chronic stress leads to dysregulation of the HPA axis and eventually to adrenal fatigue. So early on, cortisol is overproduced due to the constant stress signals. And then over time, the HPA axis becomes downregulated. Cortisol production can drop below normal, leading to fatigue and poor stress tolerance, brain fog during the day. And then, of course, the chronic stress impacts your sleep. So elevated evening cortisol it'll delay your sleep onset, reduce REM and slow wave sleep, and it lowers your melatonin production. So this is where the adaptogenic herb ashwagandha works better later in the day as it decreases cortisol. And it's one of the mechanisms that leads to feeling relaxed and eventually feeling tired. So ashwagandha, you'll hear me talk about a lot, decreases the cortisol stress response and helps to reestablish that cortisol balance that we're looking for. Because when the brain and the body remain in a state of hyperarousal, that just perpetuates the wired but tired feeling, and therefore you can't sleep at night.
Absolutely. So let's talk a little bit about low sleep and high stress, as I think you've referred to previously as an invisible inflammation engine. So, how does that impact hormones and metabolism and immune health?
Well, that's an excellent question, and the connection between sleep and stress and inflammation and hormones, metabolism and immunity, it's one of the most important and I think clinically relevant physiologic loops to understand. And I'll give you a clear systems level explanation that I follow for integrative clinical insight and treatment. Poor sleep and chronic stress activates the stress response as we discussed. So both sleep deprivation and physiologic stress activate the HPA axis and the sympathetic nervous system, which causes cortisol to be elevated, and it increases adrenaline and noradrenaline and norepinephrine. So this shifts the body into a constant fight or flight physiology rather than a rest and repair physiology. And then the normal circadian rhythm of cortisol being high in the morning and low at night flattens. Cortisol will remain high at night and be blunted in the morning, further disrupting the circadian rhythm, causing you to feel tired during the day and inability to sleep at night. So going back to where and how this relates to inflammation, the chronic activation of the stress system causes your immune system to become chronically pro-inflammatory, meaning your body increases production of pro-inflammatory, what we call cytokines, interleukin 6, TNF alpha, interleukin 1 beta, C-reactive protein. All of these inflammatory markers will rise, and that causes more inflammation in the body. And as we know, inflammation is not necessarily good for your body, especially on a chronic basis. So mechanistically, cortisol resistance then develops, meaning the immune cells stop responding properly to cortisol's anti-inflammatory effects. So it puts your body in a pro-inflammatory state, which is not a good place for your body to be in. And then inflammation disrupts your hormone balance. Chronic inflammatory processes impact nearly every endocrine axis in your body. The HPA axis with your adrenal glands, your thyroid gland, the gonadal hormones, testosterone, estrogen, progesterone. So the result is people get low testosterone, or men will get low testosterone. Women get low estrogen and progesterone, and that leads to decreased libido, reduced fertility, fatigue, growth hormone, and melatonin. These are all affected by inflammation. And everyone's familiar with growth hormone, or if you're not, growth hormone is something that you have a lot of when you're younger and you have less as you age. And growth hormone helps your body to repair itself. So the less you have of this, the more your body is aging and not repairing itself. Inflammation also affects metabolism. This is something that's real important to understand. It leads to insulin resistance, and that's a pre-diabetic state. It leads to mitochondrial dysfunction. Mitochondria are the powerhouses of your cell. That's where your cells make energy. It's called ATP, adenosine triphosphate. And this is really an area of active attention right now. You've probably heard about this in the in mainstream media. It's known as mitochondrial health, and we'll talk more about this in another podcast episode. And appetite dysregulation. Here's something that's super important to understand: that inflammation will affect your weight. I don't want to get into all the nuances of how it happens, but mechanistically, ghrelin and leptin signaling are disturbed, makes you more hungry. It decreases your satiety, or the feeling of being full. And this is where the GLP-1 peptides like semaglutide and tirzepatide come into play, which can reverse some of these symptoms. Unfortunately, inflammation leading to issues with appetite dysregulation makes people gain weight, especially central fat and adipose tissue around your waist, and this gives you a higher risk of cardiovascular disease. So lots of different things happen with inflammation. Inflammation affects the immune system, something we call inflammaging. So as your immune system is not functioning properly, it leads to more inflammation and faster aging. So there's a lot of effects that inflammation causes on your body. So we definitely want to be able to address this. And if sleep is one of the major factors that will help decrease inflammation, that's a good area to focus on.
Absolutely. And what would you say is maybe one surprising symptom or condition that you've traced directly back to poor sleep in your practice?
One surprising symptom, I don't think I can give you just one symptom. As you can see, there are so many, but I'll list them out for you. I mean, poor sleep has really wide-ranging effects, and some of them surprising, even to some clinicians. Some of them not so surprising. But some of the ones that can be directly traced back to poor or insufficient sleep. Let's look at the neurologic and cognitive functions. Brain fog, poor concentration, even mild sleep loss impairs your attention, your processing speed, memory consolidation. And recently, creatine has been researched and shown that it crosses the blood-brain barrier. It increases cellular ATP production or energy production in your brain, and can reduce brain fog. And even some studies have been done where patients that were sleep deprived after taking creatine at certain doses, you can actually reverse the cognitive impairment, and these patients will then their brain function returns to normal as if they weren't sleep deprived. So this is an active area of research. One of the other reasons why I recommend creatine for patients, especially those that have underlying memory dysfunction. There's an increased risk of dementia, mood instability, ADHD-like symptoms. Let's talk about some of the metabolic and endocrine effects from poor sleep. Insulin resistance, which is a pre-diabetic state. Weight gain despite dieting. I mean, how many patients or how many people out there diet and have difficulty losing weight and are wondering why? A lot of it can be traced back to poor sleep and endocrine disruption, and that causes you to have difficulty losing weight, and therefore your diets don't work for you. Thyroid dysregulation, low testosterone and estrogen balance. Let's look at some of the cardiovascular effects in poor sleep. Hypertension that's resistant to medication, increased arrhythmia risk, and especially atrial fibrillation, accelerated atherosclerosis, which leads to more heart attacks and strokes. There are immune and inflammatory effects from poor sleep that we discussed, chronic low-grade inflammation. This can lead to autoimmune flares, frequent infections. Some other surprising links to poor sleep: chronic pain sensitivity. Sleep deprivation lowers pain thresholds and can heighten fibromyalgia-like symptoms. If anyone out there has fibromyalgia, they'll certainly know that their symptoms are much better when they have a good night's sleep, and they're much worse when they don't. Gastrointestinal symptoms, disrupted sleep can worsen irritable bowel syndrome, reflux, gut permeability issues, leaky gut syndrome. There's skin aging, poor wound healing, migraines, tension headaches. So, as you can see, there's not just one, but there are many surprising symptoms that you can relate back to poor sleep.
When it comes to sleep, I'm curious about the Popkin method approach. So, how do you evaluate stress and sleep in your patients? Are there specific labs or sleep patterns or even wearable data that you look at?
Well, as we discussed, and anyone that knows the Popkin method, the first part of the Popkin method is lifestyle modification, and the major component of lifestyle modification is sleep improvement. So there's lots of different ways, and this is a very practical question. There's lots of different ways to integrate objective measures into a functional or precision medicine program. So how do you comprehensively evaluate stress levels and sleep quality? Using laboratory markers, validated scoring systems, and wearable data. There's lots of different ways, actually, and it's funny because most people that have been to the doctor, they generally don't focus on lab testing or any specific testing to evaluate your sleep or your impact on sleep. And I think recently, with technology advances, people are kind of doing this themselves, right? They get the Oura Ring or they've got their Apple Watch, and they're looking at their sleep and their sleep patterns, which is good. It's putting attention towards it, but unfortunately, they don't know how to use this data to actually improve the sleep. They're tracking it, but they're not necessarily improving it. So some of the things that we do, I look at certain laboratory tests. So when patients come to me specifically for sleep, I want to look at a couple things. Now, we've talked about cortisol elevation all throughout this podcast. So there's no surprise that the first thing we look at is your cortisol level. Now, cortisol is something that you don't just check one point in time of the day, because cortisol, as I mentioned, should be higher in the morning, and it should peak throughout the day and then come down at night. So what we do is something called a cortisol 4-point salivary test, or a Dutch test. I also look at cortisone in the urine to see how much cortisol is actually being produced. Look at other things like ACTH levels, DHEA sulfate levels, sympathetic activation and inflammation. We talked about this as well. How do we check this in the body? Remember, we talked about inflammation being elevated from poor sleep and stress. How do you measure that in a blood test? Well, we look at things like HSCRP, high sensitivity C-reactive protein. We can look at interleukin 6 to TNF alpha. I look at plasma or urinary catecholamines, which is epinephrine and norepinephrine. I look at homocysteine. Homocysteine looks at your methylation and stress response. So other things that I look at, we talked about, putting you in the cortisol excess being a pre-diabetic state. So I'm going to look at fasting glucose. I'm going to look at insulin levels. I'm going to look at hemoglobin A1C, which is a marker for diabetics and even non-diabetics, looking at their long-term glucose control. I'll look at a thyroid panel. Most patients, when they go to the doctor and they're having their thyroid medication adjusted, a lot of times they're really only looking at the TSH, thyroid stimulating hormone, but really we need to be looking at free T3, T4, reverse T3. It's a complicated cascade of different thyroid hormones that we want to look at. And then the sex hormones, testosterone, estrogen, progesterone, DHEA, pregnenolone. These are all things that can be affected by poor sleep. So those are the lab tests that I look at. Some of the sleep quality and stress scoring systems that I use, there are many different validated sleep questionnaires. The Pittsburgh Sleep Quality Index, or PSQI, looks at your global sleep quality. The one that's probably most well known would be the Epworth Sleepiness Scale, or the ESS, which looks at your daytime sleepiness levels. So people that sleep poorly at night, they have symptoms during the day of excess daytime sleepiness. So this test really pulls out those patients or evaluates those patients that have this. There's an insomnia severity index, or an ISI. There's something called a stop bang, which screens for sleep apnea. Sleep apnea is pretty common. Sleep apnea is generally caused by obesity. And unfortunately, 60 to 70% of Americans are either overweight or obese. So it's something we really need to look at. And without doing these tests, we really don't have any validated scoring system. So once you start to put this into the patient's diagnostic testing, you really get a good idea of how poor their sleep actually is, rather than just say, how do you sleep? And some people might say, oh, I sleep okay, or I sleep poorly. That doesn't really help me much unless I can validate and quantify that. And the quantification of how poorly someone is sleeping is, number one, it lets you know the severity of the problem, but it also allows you to then retest these patients after you do something to try to make the problem better, and then you can quantify whether what you're doing is helping. And then validated stress scales. There are ways that we can evaluate stress, something called a perceived stress scale, or PSS, which looks at a patient's subjective stress load. Something called a DASS, DASS 21, which is depression, anxiety, stress scales. and something called the Burnout Assessment Tool, or the BAT, which looks at chronic stress, occupational burnout. So all of these things are rather important to quantify just how bad a patient's sleep and stress level is. And then the wearable data, the objective biometrics. Everyone is getting into these. I don't know too many people that don't have a smartwatch that looks at some form of metric for their sleep quality. But what we're looking at on these wearables are heart rate variability, which gives us an idea of parasympathetic tone and recovery. We talked about the parasympathetic nervous system. And looking at heart rate variability, having a decreased heart rate variability indicates that you have high stress or poor recovery. But we look at resting heart rate. That's pretty simple. The higher your resting heart rate, the more sympathetic tone or fight or flight tone that you have. It gives you an idea of your basal sympathetic load. We look at sleep stages with these wearables. We look at REM sleep. We look at deep sleep, light sleep. Looking at your sleep architecture is rather important. People think that when they're sleeping, they're actually getting restorative sleep. But if you're not getting good REM sleep or deep sleep, then the sleep is not really effective in helping your body to recover. The wearables also help us look at sleep latency and sleep fragmentation, onset and maintenance quality of your sleep. How quickly do you fall asleep? Do you stay asleep? How many times do you wake up? People wake up and fall asleep all the time. They may not recognize that they're waking up, especially people with sleep apnea. Some people with sleep apnea, their brain wakes up hundreds of times a night when they're trying to sleep. The patient doesn't realize that they're waking up because they're not physically waking up, but their brain is being waken up. And then if their brain is being waken up, it's not recovering. It's not getting rest. And a lot of people don't know this unless they're studied or they're tested. So the wearables are very good for helping us with that. Body temperature variation measures your circadian stability. Your body basically goes to sleep when the temperature level drops, which is why being in a cold room helps people sleep better. And your body wakes up when the body temperature raises. So body temperature variation is very important. And then respiratory rate and oxygen levels can indicate whether you have sleep disordered breathing. As we mentioned, obstructive sleep apnea, people literally, their airway closes, so they don't get enough oxygen in their brain. The oxygen level drops, and then your adrenal glands will stimulate hormones to help wake your brain up, which will wake your body up and get you breathing again. So when this happens hundreds of times a night, not only are you having adrenal stimulation at night, which you're not supposed to have, but you're not getting restorative sleep. So it's really a vicious cycle. So when you take all of this information, the laboratory data, the sleep quality and the stress quality scores, and we put them all together, we can really get a really good integrative interpretation of what type of sleep issue you have. And not every sleep problem is the same. So when you overlay these data, some of the patterns that we see, we'll see a flattened cortisol curve, low heart rate variability, and poor deep sleep, which is indicative of a chronic sympathetic dominance from stress, a chronic fight or flight state. Some people have elevated inflammatory markers like HSCRP and a high ACTH and a high cortisol level. This tells me that they have a very high inflammatory stress burden. So the focus would be on decreasing inflammation. And again, going back to improving sleep, there are other ways that we can improve on decreasing inflammation. Some supplements that we use, a lot of times we'll use omega-3 fish oils to help decrease inflammation, curcumin or turmeric. There's lots of ways that we can combat inflammation. As we mentioned, it's a loop. So if you decrease inflammation, you sleep better. And if you sleep better, you decrease inflammation. So we have to attack it from both levels. Some people, I see a low DHEA and low heart rate variability. That tells me that their adrenal glands are exhausted. They're having adrenal fatigue. Some people, I see sleep fragmentation, a very high resting heart rate, and a high PSS score. That tells me that they have overactivation of the HPA axis from overproduction of cortisol, likely from stress during the day. So some stress reducing exercises later in the day and in the evening and before you go to bed Ashwagandha in the evening and at bedtime can help with this as well. So these are just some of the patterns that we see, but I think you can tell so far from this podcast that there's a lot that goes into sleep other than just, do you have a comfortable mattress? Do you have a comfortable pillow? And is it quiet in the room? There's a lot of factors that go into it, which is why it's real important to look at all of these different variables to try to fix a sleep problem.
Absolutely. There's so much more that goes into sleep than most people would think of. Like, I'm a little shocked to learn all of this. Like you said, most people think of sleep when they're, think of a comfortable mattress and going to sleep and they'll wake up and feel good. But in your practice and with your experience, can you share a real patient story of someone who came in thinking they needed medication, but they really needed was sleep rehab instead?
Yeah, well, that's everybody that comes in, right? They have a sleep problem. So the natural response is to say, I need a sleeping pill. And that's absolutely the wrong thing to do, because what I'm trying to, when I started putting this podcast together, I really had to trim it down, because this podcast could literally go 2 or 3 hours and could serve as a primer for a sleep medicine program. So it's very nuanced, and certain examples that I see throughout my practice. I'll give you a very common example. First of all, everyone, like I said, comes in and they think that a sleeping pill is going to fix the problem, and really what that does is it forces sedation but doesn't fix the problem. So it really, all it does is just it makes the problem worse, and patients don't get better. They then get habituated to these medications, and now you've traded one problem for another. In fact, you haven't traded, you just added another problem on top of it. So I'll give you a realistic clinical example. This is an actual patient. I'll change the name. We'll call her Sarah. Her background, she's 42 years old. She's a corporate attorney. Her chief complaint when she came to see me, and this is maybe about 2 months ago. So, I see a lot of people with these problems, but this is a really good example. She came in and she said, "I can't sleep. I need something stronger than melatonin." So that's pretty common, that people are DIYing their healthcare, and melatonin seems to be the go-to, or Tylenol PM, or Advil PM. The PM is just Benadryl, and Benadryl just makes you tired. So anyway, I'll give you some history. For about 6 months, she was unable to fall asleep before 1:30 or 2 o'clock in the morning. Now, as a corporate attorney, she had to be up early to work. So right there, that's a problem. If you're not getting to bed till 2 in the morning, you've got to get up at 6 o'clock. Right there, you're getting 4 hours of sleep, if you're even sleeping those 4 hours. She would wake up feeling exhausted, yet feeling tired and wired and anxious most evenings. She tried several different over-the-counter sleep aids with no success. I won't go through the ones she took, but you can just imagine just any of the stuff over-the-counter. Benadryl was definitely one of them. Her lifestyle throughout the day, she would typically, 3 to 4 cups of coffee throughout the day. She often works on her laptop until midnight, which is a recipe for disaster if you want to sleep. She'll skip meals. She'll exercise late at night because she's tired in the morning, and she had more energy throughout the day. So again, you can tell she had that cortisol flattening of the curve, and reversal of the curve, where she actually had more cortisol at night than during the morning. So that's a problem. And the worst thing is she went to bed with her cell phone, in her hand. I'm sure most people, can relate to this. They're in bed, with their cell phone, either holding it above their head with the light going in their eyes, or shielding their partner from the light, turning to their side and looking at their cell phone, giving her brain stimulating inputs when she's trying to wind down and fall asleep. So I call this information FOMO, fear of missing out, which is an attempt for people to get the most information out of their day. So they think that by winding down with their cell phone, they're going to kind of recap the day by, learning a couple different things or going over some stuff that might make them feel more relaxed. But really, all they're doing is they're sending energy input into their eyes and their brain and keeping themselves awake. So more about Sarah. She's relatively healthy on no medications. So I did some basic laboratory tests on her. Of course, I did the 4-point salivary cortisol. which showed exactly what I expected: elevated cortisol at night, blunted in the morning. So she had a flattened rhythm. She had a low normal DHEAS, dihydroepiandrosterone dione. Um, it was low normal, indicating chronic adrenal fatigue. DHEAS is also one of your hormone precursors, so if that gets messed up, now you're not making estrogen and progesterone and your other hormones that you need to. She had a mildly elevated HSCRP. It was 2.8, which showed me she had some mild inflammation. And she did actually use an Oura ring. She purchased this to try and fix the problems herself. What it did do is it gave us some data. Her average sleep score when she had come in was 62 out of 100, which is not good. Her heart rate variability was low. She had frequent nighttime awakenings and very minimal deep sleep. It was like less than 45 minutes of deep sleep, which, explains why she felt tired. So the initial impression, she looks like, if she had described this to someone, that she had insomnia, but pharmacologic sleep aids, would only suppress her symptoms. So sleeping pills are not the answer. So her profile is definitely a hyperarousal of the HPA axis with elevated cortisol throughout the day, leading to circadian rhythm disruption and sympathetic overdrive. And the underlying mechanisms, you can pretty much guess it right now, right? Chronic stress from work, late night work, leads to sustained cortisol and catecholamine release, which is epinephrine and norepinephrine throughout the day, leads to adrenal fatigue over time. Evening blue light and cognitive stimulation. When you're forcing light into your eyes after it gets dark out at night, you're suppressing your melatonin release, and melatonin is what makes you fall asleep. Caffeine overuse. You should really not have any caffeine after maybe 1 p.m. In the afternoon, because it's going to affect your sleep at night. And really poor meal timing. She had unstable, blood sugar cravings, and when you eat late at night, it reinforces your nighttime alertness. You're not supposed to be taking in a lot of calories, especially sugar, later in the day. You're supposed to be winding that down. She also had low heart rate variability and low DHEA, as I mentioned, which is physiologic evidence of poor recovery and adrenal fatigue. So this is something that I see, relatively common on a fairly common basis. And so what is her sleep rehabilitation plan, right? What are we going to do with it? Why didn't she, or why couldn't she do this herself, right? She had an Oura ring. She's a corporate attorney. She's an intelligent person. But again, she's not trained in sleep medicine. She's an attorney. So this is where, professional help comes in. So the first thing is I wanted to reset her circadian rhythm. So the first thing I do for anybody with any sleep problem, and this is real important, anyone that's listening to this, most of what I'm going to tell you, you can do yourself. You can, write this down, follow these examples, and it's easy to do. You can implement it right away. Morning outdoor light exposure. So the first thing that I tell patients to do when they wake up is to go outside and get natural light in your eyes if you can. Get forward motion, so your brain starts to wake up. No screens after 9 o'clock at night, meaning no laptops, no tablets. Get off your phone. Have a consistent bedtime, awake sleep cycle. Go to bed at roughly the same time. Get up at roughly the same time. And no more going to bed with your cell phone. That's just the worst thing that you can do. You're stimulating your brain, yet you wonder why you can't go to sleep, right? And then there's nervous system down training. So 20 minutes of parasympathetic buffer before you go to bed. Breathing exercises, journaling, yoga, something that'll activate the parasympathetic nervous system, the rest and digest system, is going to be helpful. Nutritional timing, as I mentioned, no caffeine after 1 o'clock in the afternoon. Try to have a protein-rich breakfast, small and if you're really having difficulty with cravings at night, maybe a small complex carbohydrate snack before you go to bed to prevent that dip in your blood glucose, which might make you more susceptible to waking up. But again, I'm not recommending this for everybody. You have to look at other testing to see if that's going to help you with your symptoms. And then targeted supplements. Magnesium bisglycinate is one of them. Most people are deficient in magnesium, and the bisglycinate form is real helpful for helping with sleep. Ashwagandha, as I mentioned, decreases the cortisol in the evening, which is necessary to help you rest. L-theanine in the evening. All of these things affect cortisol. Um, Stress physiology support. Morning exercise only. Don't exercise late in the day because you're stimulating hormones in your body that's going to keep you awake. Sleep environment optimization. This is one of the most important things. You want the room to be cool. You want the room to be dark. You don't want to be charging your phone near your bed. The magnetic radiation that comes off of your phone while you're charging it. You don't even necessarily need to be on your phone for this to cause a problem. Just the electromagnetic radiation from your phone charging next to your head can cause you to have poor sleep. And a lot of people don't realize that either. Leave your phone in the kitchen or another room, plug it in elsewhere. Definitely don't be on your phone at night. So long story short, what was her 6-week outcome? And I say 6-week outcome because I typically don't like to wait too long to follow up with people because these interventions tend to work pretty quickly. And again, I don't want, I'm not going to give someone a 3-month follow-up and let them suffer for 3 months if what we're doing isn't working. Or if it is working, then I want to make sure that we are layering other types of things on top of this to fix the problems that the poor sleep caused. So now she comes back in 6 weeks. Her sleep onset, we looked at, her Oura Ring data. Sleep onset is now within 20 to 30 minutes of lying down. Her total sleep time increased from 5 hours to 7 hours. I'm sorry. Morning energy, she says she was usually waking up before her alarm. That's because she was going to bed so much earlier and getting better sleep. Her heart rate variability improved. It increased to 42 milliseconds. The cortisol curve normalized. So again, when I did the 4-point cortisol test, it showed a reestablishment of cortisol being elevated in the morning and lowering at night or later in the day, like it should. And no medication was required. She just went on magnesium bisglycinate at night. She went on ashwagandha at dinner time and bedtime. And she initially took L-theanine, but within about the 2 to 4 week mark, she got rid of the L-theanine and just took the magnesium and the ashwagandha. So really, if you look at what we did here, she did not need a sleeping pill. She needed sleep rehabilitation, which is why a structured lifestyle modification program that addressed her stress, her circadian misalignment, and her recovery was really improved by doing nothing more than lifestyle modification. So sedatives would have just masked the problem, further suppressed the restorative sleep phases, especially those deep sleep and REM sleep cycles. So again, most of this or all of this you can accomplish on your own by making those changes, and understanding why you're having the problem and then making the changes to it. And I think a lot of why people are having such difficulty sleeping is because of all the information that we have access to now. We years ago, go back 50 years, you weren't taking your laptop to bed. You didn't have a cell phone that gave you all this information. People were able to wind down a lot easier. Go back 100 years now. You didn't have any of this technology. Go back 500 years. 500 years ago, you woke up when the sun came up and you went to sleep. The sun went down and that was your natural circadian rhythm. You didn't have all these things to help disrupt your sleep and so forth. So progress in some areas can cause problems in others.
Absolutely. Yeah. There's so many influences now that we have today that we didn't have previously that can really disrupt your natural being. But you're obviously big on not prescribing heavy medicine. So let's break down the toolkit, if you will. What's your go-to protocol for improving sleep quality without relying on heavy meds?
Well, I pretty much gave the example with Sarah regarding my toolkit, and basically everything that I do is clinically grounded, evidence based. And my protocols for improving sleep quality really focus on lifestyle modification. I mentioned probably mentioned most of them with Sarah, but I'll go through them here and then talk about, and I'll do this without even mentioning anything regarding supplements, just anything that you can do as a patient, that if you have a problem with sleep, you can add these to your toolkit And this is what I use for my patients. So the first thing you want to reset your circadian rhythm. So the first thing is in the morning, you want to try to get 10 to 15 minutes of outdoor light within 30 minutes of waking up. And what that does is that suppresses the residual melatonin in your body and it boosts the cortisol. And then in the evening, you want to dim the lights and use screen filters or not use your laptops or anything like that later in the evening. And what that does now is that now it suppresses cortisol and raises melatonin. So those two hormones alone, if you can have elevated cortisol in the morning and suppress your melatonin, and then at night you suppress your cortisol and raise your melatonin, you reestablish your circadian rhythm. You can do this on your own. You don't need pills. You don't need supplements. You don't need anything. You can do that on your own by just doing some simple lifestyle modification activities. You want to have a fixed schedule, a consistent bedtime and wake time, even on the weekends. You want to try to get up and go to sleep at the same time. What that does is it resets your master clock. So your brain is used to a normal circadian rhythm. Temperature control, as I discussed, the room should be cool. Ideally, 65 to 68 degrees is optimal. That might be difficult in some warmer climate areas, but it's important to have the room to be cold or cool. What that does, that triggers sleep onset by getting your core temperature to drop. In some cases, in extremes where patients are not responsive to this, I'll have them in the evening, I'll have them take a warm shower. And your body's response to a warm shower is to drop its body temperature afterwards. That will trigger the sleep response. That's why the reverse of that, the cold plunge, your body's response to a cold plunge in the morning would be that it raises its core temperature afterwards. So something as simple as in the morning, I tell my patients, you don't need to have you don't need to have this an expensive cold plunge pool. Just go in the shower and turn it on and use cold water. It doesn't have to be that cold for you to get that shocking effect. And then your body will then raise its core temperature and help you to wake up. So that's the first thing. The second thing in my toolkit, you want to downregulate the nervous system. Do some deep breathing, some just simple things that are going to help with heart rate variability training. Deep breathing, there's something called the 4-7-8 breathing technique. You can Google that. It's super simple to do. And you do that before bed, and that'll activate the parasympathetic nervous system, which helps with your rest and digest portion of your of your body. Yoga or guided body scan at bedtime helps to reduce cortisol hyperarousal. A guided body scan is you're laying in bed and you're just thinking about, start from the toes and work your way up. You're just basically doing a body scan. My feet are comfortable. My right knee hurts a little bit. My back feels better today. Just kind of scan your body and just, you're focusing on yourself, not external things like your job or your kids or your car or your friends or what you just watched on TV, things of that nature. You want to do a mind dump with journaling about an hour before bed. It helps to prevent rumination. If you're someone who ruminates about things during the day, did I forget something? Did I do the just write it down. Go through, just do a mind dump. This way your brain is not thinking about it when you're trying to go to sleep. White or pink noise. Right now, there's so many different things that you'll see. There's white noise, pink noise, now there's brown noise and green noise. The bottom line is what it does is it helps to relax your brain when you have this background, white or pink noise. Then you want to support your sleep physiology with nutrition. Again, I said this: no caffeine after, let's say, 1 o'clock in the afternoon. That helps to reduce adenosine receptor blockade and allows your body to clear that caffeine so that when you go to sleep, you don't have caffeine in your system. You want to avoid alcohol or late evening sugar. So I know a lot of people, they will say, oh, I'll have a glass of wine or two before I go to bed. It helps me sleep. And it might, because typically, alcohol is a sedative. The problem is people that use alcohol to help them relax, you don't get a restorative sleep. Your body may sleep, but your brain is not getting that restorative sleep. So you want to avoid alcohol as a self-treatment for sleep issues. And as I mentioned, you can do all of this starting today with lifestyle modifications I mentioned. You don't need anything special other than to implement these lifestyle modifications.
Absolutely. And with lifestyle modification, and you've mentioned certain supplements as ways to help you get better sleep. So you've mentioned supplements, for example, like magnesium and creatine and ashwagandha. So which ones actually help with sleep and stress?
So my toolkit contains a number of supplements that I use in specific situations. I'm going to list them all. I'm going to review them here, breaking them down into their mechanism of action. By no means am I saying you need all of these. You don't. Again, this is where outside of magnesium and ashwagandha, these are the supplements that I use in specific situations. So L-theanine, 100 to 400 milligrams at night. It increases your alpha brain waves. It lowers anxiety without sedation. You do that in the evening. Magnesium bisglycinate, 200 to 400 milligrams, which increases the inhibitory neurotransmitter GABA, which promotes calmness. You want to take that in the evening and or at bedtime. You can actually take a supplement called GABA, GABA, 100 to 300 milligrams. It helps to promote calm by activating the GABA receptors, which help to promote calmness. You want to take that at bedtime. L-tryptophan, yes, it's the same chemical that's in turkey that makes you tired after Thanksgiving. And so you can take an L-tryptophan supplement, which will help melatonin secretion. Take that about an hour or two before bedtime. And then ashwagandha, one of my favorites, 300 to 600 milligrams. Ashwagandha has a dual action. It enhances the inhibitory GABA, GABA system in the brain, which helps you to relax. And it also, as we mentioned, helps decrease the HPA axis by decreasing cortisol. You want to take that in the evening and or at bedtime. Now, focusing on circadian rhythm and hormonal regulation, melatonin, we talked about this. I don't use a lot of it in my practice. A lot of people do like it. I tend to not use it that much. It helps with phase shifting, circadian rhythm. It's also an antioxidant. So you could say it has a dual action there as well. You want to take that 60 minutes before bedtime. Phosphatidylserine, 100 milligrams to 400 milligrams. It helps to blunt the evening cortisol response, helps to reduce that wired state. You want to take that at dinner or bedtime. L-taurine, 1 to 2 grams, helps with GABA modulation. Take that in the evening. And again, back to ashwagandha, because it again has that dual effect of stimulating or enhancing GABA, which will help with calmness and decreasing cortisol. You want to take that in the evening or at bedtime. And then some of the things for patients that have adrenal gland fatigue, you want to take rhodiola in the morning, which helps to boost your cortisol in the morning and help you to wake up. So you only want to take that in the morning, not later. Basil does the same thing, helps with cortisol modulation, but the difference is it reduces it. So you want to take that in the evening. So we're focusing on cortisol. One raises it, one lowers it. Ginseng, you want to take that in the morning for adrenal support. Again, these are for patients that have fatigue dominant profiles. So very important you take them when you're supposed to. And let's talk about inflammation and oxidative stress. We talked about how inflammation decreases sleep, and poor sleep decreases or increases inflammation. So omega-3 fish oils help to lower neuroinflammation and anxiety. Curcumin is very good to reduce inflammatory biomarkers. And CoQ10, it actually acts as a mitochondrial energy support. Typically, we take this in the morning, and a lot of people who are taking statin medications for cholesterol are deficient in CoQ10. So this helps with patients that are on these medications as well. So my toolkit, as we mentioned, includes lifestyle modification and or supplements. So to kind of summarize everything, in the morning, you want light exposure. And if you're going to take a supplement, you want to take adaptogens like rhodiola or ginseng. In the afternoon, typically you want to maintain stable glucose and hydration and limit your caffeine intake. Remember, no caffeine after, let's say, 1 o'clock. In the evening, if you're going to take supplements, magnesium bisglycinate, ashwagandha, phosphatidylserine, L-theanine, and glycine, that is helpful, along with all the other lifestyle modifications we talked about. Dimming the lights, limiting your screen time, no exercising in the evening, things of that nature. And then your bedtime ritual, do not bring the phone into the bedroom, plug it in the kitchen or someplace else. You want to do some guided breathing, make sure the room is dark and quiet, cool, so you set up the proper environment for sleep. So again, these supplements are targeted, and I pick and choose them based on what the patient's symptoms are. So again, by no means do you need any of them or all of them. Basically, if you do the lifestyle modifications, you really don't need much along the lines of supplementation. But if you do, the ones that I mentioned could be very helpful for you.
Absolutely. And we talked about all these supplements, but what role do peptides or hormone optimization play in helping people recover their energy or reset their sleep cycle?
This kind of ramps it up to a higher level. This gets into the bioregulatory layer of recovery medicine, where peptides and hormone optimization help to restore the body's circadian rhythm, mitochondrial energy output, neuroendocrine balance, all of which underpin energy production and sleep quality. So I'll give you a detailed, clinically integrated explanation. So the core concept, as we've been talking about, chronic stress, inflammation, poor sleep, and aging all blunt the hypothalamic signaling in the brain and disrupt, if you remember, the HPA axis that we talked about with cortisol, or the HPG axis with the sex hormones, testosterone, estrogen, progesterone, and the HPT axis for thyroid hormones and so forth. So peptides and hormones, they work by retraining these signaling pathways. They don't force sedation or force stimulation, but they help the body restore its own rhythm. I'll say that again. They help the body restore its own rhythm. And that's super important to understand, is we want to get the body back to as much of a physiologic state as possible. So I'm not going to get too deep into the peptides in the next podcast episode. We're going to talk about peptides in detail for many different situations. But some of the peptides that I like to use, CJC 1295 and ipamorelin, helps your body pulse growth hormone and IGF-1 during sleep, which helps to increase slow wave deep sleep activity, tissue repair, and improve morning energy. There are other peptides, epithalon, which helps to regulate the pineal gland for melatonin synthesis. There's copper peptides, which help with systemic repair and anti-inflammatory effects. Thymosin beta-4 for tissue healing and autonomic balance. And it may indirectly improve restorative sleep through reduced inflammation. Some of the stress and adaptogen neuroregulatory peptides, C-Lank helps to modify GABA, which helps promote calmness. There's something also called CMAX, which helps to enhance dopaminergic and neurotrophic tone. And BPC 157, which I use a lot of in many different instances. It helps with the gut-brain axis repair, and neurovascular healing. It improves gut-derived serotonin balance and autonomic recovery. So peptides are really stepping it up to the next level. We'll talk more about them in my next podcast episode in more detail. So going into hormones now, again, as we talked about, hormones affect your sleep cycle. The most important one we talked about is cortisol. That's the HPA axis hormone that we want to look at to get an idea of what level of dysfunction patients have in regards to cortisol production. I also look at the thyroid hormones. I look at the sex hormones, testosterone, estrogen, progesterone, DHEA, pregnenolone. I look at growth hormone, insulin-like growth factor 1, melatonin. So lots of different things go into this. It's very, very nuanced. And it's, again, something that if lifestyle modification and then supplements don't help, then we're going to really look into some of these other hormone modulation techniques. So some key connections between hormones and energy and sleep. People that have low testosterone or estrogen imbalance leads to poor sleep architecture, reduced mitochondrial efficiency. Women that have low progesterone have a reduced GABAergic system, whereas they they don't have that calming effect that progesterone offers them. So it leads to insomnia and anxiety and restless sleep. So that's why I look at hormones. It's part of the Popkin method. Again, we talk about lifestyle modification, diet, exercise, supplements, peptides, and we go into hormone modulation. And that's why it's important. After that, we look at things like stem cells and exosomes, and then management of prescription medications. So again, all these different things interplay. It's quite nuanced. So that's why it's important to get a good look at as many things as possible to try to diagnose a sleep problem. We look at things like growth hormone, thyroid function, and cortisol production in your body. So all of these things can interplay together and put into a comprehensive treatment program.
Absolutely. And, we've covered so much today, but for someone who is listening right now and they might be feeling burnt out, for example, where should they start?
Well, and I'm exhausted just going through all of this, right? It's really, there's a lot of information here. The clinical outcomes that we're looking at from all of these different modalities is we want to reestablish a natural sleep onset. We want to increase deep sleep duration. We want to improve morning energy and cognition. We want to stabilize cortisol production. We want to enhance daytime alertness and mood. And we certainly want to decrease inflammatory markers. So really, for anyone that's listening right now, you can see how involved this is and how nuanced it is. So really, the healthcare DIY approach, do-it-yourself approach, is not necessarily recommended. You definitely want to seek the help from a physician who's qualified to make proper diagnoses and create a tailored treatment plan, because not everybody has the same sleep difficulty architecture that you have. And so we want to make sure that we properly diagnose it. And I've been treating sleep problems for the majority of my career because I recognized early on that without proper sleep, none of the treatments for any of the other medical issues that I'm treating are as effective as when the patient gets restorative sleep. So having said that, the takeaway message here is that simply addressing a lot of the basic principles that I discussed related to lifestyle modification and proper sleep hygiene can go a long way towards fixing most sleep problems. And these are things that you can implement today. They include establishing a fixed wake sleep cycle, get up at the same time every day, go to sleep at the same time every day. You want to get early morning light in your eyes as soon as you can upon wakening. You want to limit your caffeine and other stimulant intake, and maybe cut that off at about 1 p.m. You don't want to be drinking caffeine much past that. You want to create a digital sundown by putting down your electronic devices an hour or two before bedtime. Do not take the cell phone into bed, as I mentioned. You want to create a proper sleep environment with a dark, cool bedroom. Do not use alcohol as a sleep aid. And if you're starting with any of the supplements, if those lifestyle modifications don't work, I would choose magnesium bisglycinate in the evening, because most people, as I mentioned, are deficient in magnesium, and the bisglycinate form of magnesium is proven to help with improving sleep. Beyond these recommendations, if you're still having sleep issues, that's the time to seek a physician that's skilled in sleep medicine. So, if anyone is interested, you can message me directly to set up an in-person visit at my Hollywood, Florida office. Or you can schedule an online virtual consultation with me to properly evaluate your unique sleep issue. Just go to the popkinmethod.com website and click on the message me or schedule an appointment button, and you can set up your online visit. You can also directly message me on any of my social media platforms, including Facebook, LinkedIn, Instagram, or on my YouTube channel. And you can also email me directly at mcpopkin, Popkin, MD @yahoo.com. Again, that's mcpopkin, MD @yahoo.com. Just put sleep in the subject line, and I'll be happy to get you scheduled for an evaluation with me so we can address your particular sleep issues.
Thank you so much for all this information. I think I have to reset my sleep patterns as well. Definitely going to try some of the things you recommended. I know myself, and probably most people listening are guilty of taking their phone to bed and not having proper sleep hygiene. So definitely a lot of information to take into account when you just think about your everyday sleep patterns. So thank you again for that. And sleep and stress aren't soft topics at all. There's so much that clearly goes into this. So they're definitely the silent drivers of nearly every chronic symptom that we face today. And when you finally fix them, everything else starts working again. So if this episode helped you rethink how sleep and stress are affecting your health, share it with someone who needs to hear it, share it with a friend, share it with anyone. Everyone can benefit from this. And subscribe for more insights from Dr. Popkin. And if you are ready to take control of your health, head to thepopkinmethod.com to connect with Dr. Popkin directly. And this is the Popkin Method, and we will see you next time.